Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Vicodin. This is a combination product that contains hydrocodone as well as acetaminophen or Tylenol. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And if at any time during this video you find the information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first off, what will we cover in this presentation? We're going to start by talking about how Vicodin works. We'll then discuss indications or reasons we would prescribe Vicodin to a patient, then contraindications or reasons we would not be able to prescribe Vicodin, followed by examples of dosing, and then stick around to the end where we'll talk about side effects. So how does Vicodin work? Well, I did mention it's a combination product. So first, acetaminophen is a non-opiate, non-salicylate, analgesic, and antipyretic medication. The exact mechanism of action by which it exerts its analgesic action is still unknown. Hydrocodone, on the other hand, is an opioid analgesic, which has a mechanism of action related to the opiate receptors in the central nervous system. It has action similar to codeine. Now, in terms of indications or reasons we would prescribe Vicodin, we typically see this medication reserved for moderate to severe pain. And for contraindications or reasons we could not prescribe this medication to a patient, the first one would be if a patient had a hypersensitivity to acetaminophen or to hydrocodone. They would not be able to use this medication if they had a gastrointestinal obstruction. It would be contraindicated in patients with significant respiratory depression. And as well, it wouldn't be given to patients who have severe bronchial asthma in an unmonitored setting. Now for dosing with Vicodin, so if somebody was using this medication to treat pain and they were using the hydrocodone 5 mg with acetaminophen 325 mg, they would typically use 1 or 2 tablets orally every 4 to 6 hours as needed. They would adjust the dose based on their response to pain. And then the maximum dose would be 8 to 12 tablets per day. And you also have to keep in mind that the max acetaminophen dose per day is 4,000 milligrams. So if they were using more Tylenol on the side, you really have to keep that number in mind. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Vicodin, so I'll go over some of those here now. Some patients may experience nausea and vomiting, while others may experience dizziness or lightheadedness. Sedation is also a possibility. Now, some more rare but serious side effects would be some dermatological reactions such as Stevens-Johnson syndrome or toxic epidermal necrolysis. That's all we're going to talk about today with Vicodin, the combination product of hydrocodone and acetaminophen or Tylenol. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.